fairly stark warning about this ongoing debate over the ownership of the new hospital site and, of course, the delays that debate is now causing.
Yes, Caroline. So Professor Shane Higgins very keen to speak this morning about the fact that this is a really urgent situation. He speaks about the fact that this has gone on obviously for several years already, and he fears that if this deal were to fall through, that Ireland could be waiting up to another 20 years for a new national maternity hospital. When he talks about the conditions inside, he says of course they have a great team of staff who work very, very hard, but he says there's no doubt that they are working in challenging circumstances. And he points to the fact that they've had a number of sort of renovation jobs done in various different parts of the hospital, but he describes it as being sort of like putting a band-aid over what is a much larger problem. He says that the country needs this new national maternity hospital for the benefit of patients, for women and for those newborn babies. Now, speaking on the radio this morning, the Taoiseach Micheál Martin said that he believed that the issues around the new national maternity hospital had been comprehensively addressed. Professor Shane Higgins saying today that he's really keen to see this deal get over the line. He says even if it does come through this week, it's still going to take several years for the hospital to actually be built and fully established.
We've been at this for 9 years, and the legal framework which has just been published isn't something that we just put together in a matter of weeks. We can argue about the ownership of the land and the ownership of the building, but it's the clinical and operational independence of that building that's important. If the National Maternity Hospital, as it currently exists, can move out there and perform all the procedures that are permissible within Irish law and deliver the 7,000 to 8,000 babies, and that all these patients will have the opportunity to have a single ensuite room, will have the appropriate facilities in which to deliver their babies. That's what this is all about. And the legal framework protects that. And the Minister's Golden Share protects that. So there's absolutely no concern from a National Maternity Hospital perspective.
Well, Caroline, you're hearing there Professor Shane Higgins, the master here at Holles Street, saying that he has absolutely no concerns about clinical independence at what would be a new national maternity hospital co-located at the St Vincent's Hospital site. The Health Minister, Stephen Donnelly, is due before an Oireachtas Health Committee this week, Caroline, to take questions on this and to sort of allay some of the concerns that are out there at the moment. But the likes of Sinn Féin's health spokesperson, for example, David Cullinane, saying simply this land should just be gifted to the state.